Understanding H5N9 bird flu, what you need to know. The H5N9 bird flu is a significant public health concern that demands our attention. Although it primarily affects birds, its potential to infect humans poses risks far beyond agriculture and wildlife. Awareness, preparedness, and caution are crucial to minimize its impact. In this video, we'll provide you with a comprehensive understanding of what H5N9 is, how it spreads, and what you can do to protect yourself and your community. Let's explore the risks, symptoms, and preventive measures along with the efforts being made by global health authorities to combat this virus. H5N9 is a strain of avian influenza, commonly known as bird flu, belonging to the family of influenza A viruses. These viruses mainly infect birds, including domestic poultry like chickens, ducks, and turkeys. Outbreaks of avian influenza among wild or farmed birds can be devastating, wiping out large populations in a short time. The distinguishing factor of H5N9, and the reason it captures public health attention, is its ability to occasionally infect humans. Although cases in humans are rare, they can occur when there is close contact with infected birds, their secretions, or contaminated environments. Diseases like H5N9 remind us of the interconnectedness between animal health, human health, and the environment. Understanding these connections is vital for identifying and mitigating risks. In birds, H5N9 spreads through direct contact with infected individuals or through contaminated surfaces like water and feed. Wild birds, which often show no symptoms, can become carriers of the virus and spread it over long distances. Human infections, although rare, can occur in specific situations. Those who come into direct contact with infected birds or their droppings are at risk. For example, farmers, poultry workers, and those handling infected birds without proper precautions are the most vulnerable. Additionally, environments contaminated with bird flu particles, for example in live bird markets, can also serve as sources of transmission to humans. The biggest concern arises from the virus's potential to mutate. A mutation enabling H5N9 to transmit easily among humans would pose a grave threat, as it could lead to an outbreak or even a pandemic. Being cautious and minimizing interaction with potentially infected birds or contaminated environments is key to reducing the spread. While H5N9 may currently seem like a distant threat, its potential impact is significant. Outbreaks of bird flu strains like this one threaten global food security. With poultry industries suffering significant losses during outbreaks, the economic impact can be severe, affecting farmers and consumers alike. On a public health level, H5N9's ability to cross from birds to humans is particularly concerning. Although such cases are rare, they underscore the unpredictable nature of influenza viruses. History has shown us that new flu strains can quickly escalate into widespread health emergencies if not properly managed. Awareness and preparation are not alarmist. They are practical steps to protect individual health, communities, and economies from the broader ripple effects of such outbreaks. When contracted by humans, H5N9 presents symptoms similar to those of seasonal influenza, making early detection difficult. Fever, coughing, sore throat, and muscle aches are the most common signs. These may appear mild at first, but can progress rapidly if left untreated. In severe cases, patients experience difficulty breathing, pneumonia, or acute respiratory distress syndrome, ARDS. Such conditions often require urgent medical attention and hospitalization. Recognizing the symptoms early and seeking timely medical help is critical to preventing severe health outcomes. If you or someone in your household has been in contact with birds and begins showing flu-like symptoms, consult a healthcare professional immediately. Health authorities work tirelessly to manage bird flu outbreaks and prevent human infections. When H5N9 is identified among birds, stringent measures are taken, such as culling infected populations to stop the spread. Biosecurity protocols are also enforced, especially in areas where poultry is farmed in close contact with humans. Surveillance is critical for early detection of outbreaks. Governments and public health organizations monitor the spread of avian influenza in bird populations and track any cases that involve humans. Immediate reporting of unusual bird deaths by farmers or the general public can significantly aid these efforts. From farm-level containment to nationwide monitoring, these actions help control outbreaks and reduce the likelihood of human infections. Supporting and complying with these measures is a responsibility shared by all of us. Preventing exposure to H5N9 is largely within our control, but it requires informed and proactive measures. Here are some key steps everyone should take. Avoid direct contact with wild birds, particularly in areas where bird flu outbreaks have been reported. If you see dead or sick birds, do not handle them. Instead, alert your local authorities or wildlife services. Always ensure that poultry and eggs are well cooked. The virus does not survive high cooking temperatures, so consuming fully cooked poultry is safe. Practice good hygiene by washing hands thoroughly with soap and water, especially after handling poultry or visiting live bird markets. Disinfect kitchen surfaces, utensils, and any areas where raw poultry has been prepared. Use protective gear such as gloves and masks if you must handle birds and then dispose of them safely. By incorporating these simple precautions into our everyday lives, we can dramatically reduce the risk of exposure to H5N9. Global health organizations, including the World Health Organization, WHO, and National Centers for Disease Control and Prevention, CDC, are conducting ongoing research to address the challenge of bird flu viruses like H5N9. Efforts are focused on developing vaccines specifically aimed at strains such as H5N9, which would strengthen our ability to prevent large outbreaks. While antivirals and existing influenza treatments may help mitigate symptoms in infected individuals, a targeted vaccine would play a crucial role in long-term defense. Monitoring wild bird populations, controlling outbreaks in poultry farms, and studying the virus's genetic mutations are part of a multi-layered approach to preparedness. These initiatives help us stay one step ahead of any major threat. Public support is essential to these efforts, whether through vaccination campaigns, reporting outbreaks, or complying with safety measures. Working together allows health authorities to allocate resources effectively and respond swiftly to emerging risks. Understanding H5N9 is not just a concern for scientists, farmers, or healthcare systems. It is a responsibility that touches every individual. Awareness is the first line of defense. By staying informed, we can take mindful steps to reduce our own risk while supporting larger prevention efforts. When outbreaks occur, it is crucial to comply with government and public health policies, such as movement restrictions or disinfection protocols. These interventions, while inconvenient, are designed to protect not just individuals, but entire communities. Above all, it is essential to share accurate information and avoid panic. Misinformation undermines preparedness and breeds unnecessary fear. Let's commit to using trusted sources of information and encouraging others to do the same. H5N9 is not a cause for immediate alarm, but it is a reminder of the balance that exists between humans, animals, and the environment. With the right knowledge and actions, this balance can be maintained to protect public health and prevent large-scale consequences. Let's prepare wisely, stay aware, and take responsibility not only for ourselves but also for those around us. Together, we can help mitigate the risks of H5N9 bird flu and ensure a safer future for everyone.